Hello guys, welcome back to my YouTube channel Knowledge is Power. Today I am here with you all to discuss some important questions that are expected to come in your Viva exam or in the skill examination that are conducted in the state DHS DME after passing the written exam. So you can get these questions. So let us discuss this important question without delaying our time. First and foremost, you all know the interviewer they can ask about yourself. They can ask to give self introduction. Whenever they ask to introduce yourself, then you need to greet the interviewer with a big smile. You all know this. Start with the full name and a brief introduction about yourself. Add some information about what you have studied and any internship or professional experience. Mention your hobbies and interests. And obviously, you need to wear formal dress for the interview. Coming for the nursing questions, the interviewer they may ask the sites of giving injection. So, being a nursing student, this is the basic questions you all need to know. So you know the different sites of injections are deltoid, then vastus lateralis and rectus femoris, dorsogluteal site. Nowadays it is not recommended much as it can damage the sciatic nerve. Then the site is the ventrogluteal site. These are the sites for providing injection intramuscularly. Coming for the most important question, the sites for taking pulse. So when you are in the first year BSc nursing or in the first year GNM nursing, you all got to know about the sites for taking pulse. Temporal, carotid, apical, brachial, radial, femoral, posterior tibial, popliteal, pedal dorsalis, or you can say dorsalis pedis. Okay. Coming for the next important question, the color coding of intravenous cannula. So for the size 14 gauge, the color coding is orange color, and it can be used for the patients who are in trauma, rapid large volume replacement is done here. Then 16 gauge, the color is gray. It is given whenever a patient is in trauma, major surgery, intrapartum, postpartum, hemorrhage, GI bleeding, multiple blood transfer, high volume of fluids. 17 gauge cannula, the color is white and it is newly added. 18 gauze, it is the green color. For giving blood products, delivery of irritant medications during major surgery, contrast study, green cannula can be used. Then coming for the 20 gauze cannula, it is the pink color. It is the universal cannula that can be found in the hospitals. Even green color is also found. Whenever there is road traffic accident, immediately green color cannula blood is transfused. Then for the pink, generally use IV, you all know. Then antibiotics can be provided. IV analgesic can be given to the patient. Then coming for the size 22, the color is blue. It is used for the patients whose veins are very small and cytotoxic drug can be given through blue cannula. Then 24 gauze cannula, yellow cannula. It is for pediatric use or for the children. Then coming for the 28 gauze cannula, that is the violet color. It is also newly added and it is also the smaller cannula. Coming for the next question, family planning methods or contraceptive methods. So you should know these different family planning methods or contraceptive methods. First is intrauterine device. You can add here Coparty, Mirena. Okay. Then contraceptive injection. Then condom. It is the barrier method. Oral contraceptives, implants, diaphragm or cap, contraceptive pads, calendar method is a natural method can be used. Hormonal rings can be used by the couple. So now coming for the causes of communicable disease, you all know the disease that is transmitted from one person to another, either through the droplets or ear or by sneezing. You can say it from the direct contact, then it is said to be communicable disease. If we see the viruses, the common cold, flu, viral disease, pneumonia, viral hepatitis, polio, measles, AIDS, viral meningitis, chickenpox, herpes, you know, chickenpox, rabies, smallpox. So all these are disease caused by the virus. Then coming for the bacterial causing disease, bacterial foodborne illness, you know, streptococcal throat infection, TB, diphtheria, gonorrhea, Lyme disease, bacterial pink eye, bacterial pneumonia, bacterial meningitis. Then coming for the fungal infection, athlete's foot. For the protozoan disease, malaria, amoebic dysentery, sleeping sickness, rickettsia, typhus, Rocky Mountain spotted fever. All these are the causes of communicable disease. Now let us know some of the disease and that disease causative organism. So meningitis is caused by Neisseria meningitis. Lobar pneumonia is caused by Diplococcus pneumoniae. Boils carbuncles caused by Staphylococcus species. Scarlet fever is caused by Staphylococcus scarlatina. Food poisoning is caused by Clostridium botulinum. Tetanus is caused by Clostridium tetani. Diphtheria is caused by Corynebacterium diphtheria. Tuberculosis is caused by, you all know, Mycobacterium tuberculosis. Plague is caused by Yersinia pestis or Pasteurella pestis. Typhoid is caused by Salmonella typhi. Cholera is caused by Vibrio cholera. Syphilis is caused by Treponema pallidum. So these are some common disease and all these are causative organisms. Now coming for the next question, the parts of a syringe. These are the common parts: plunger, barrel, hub, needle. I hope you all know this question answer. Coming for the next question, IV drip set parts: tubing, lever connector, covered injection port, spiked covered access port, drip chamber, V track controller, filter. Okay, some IV sets they used to have some ultra filter property. Coming for the important drug atropine. So atropine sulfate is the drug that is used as an emergency drug for anaphylactic reaction. So in eye, atropine blocks muscarinic activity, results in mydriasis. Then in the gastrointestinal system, it reduces the activity of the GI tract and it can be used as antispasmodic. It can reduce the secretion. Atropine blocks muscarinic receptors in the salivary glands, producing dryness of the mouth. In the cardiovascular system, depending on the dose, at low doses, it can cause decrease in the heart rate. Higher dose of atropine cause a progressive increase in heart rate by blocking the M2 receptors on the SA node. Coming for the very important question, how to perform CPR on adults. So I'll be discussing this. At first, suppose you are walking in a road and suddenly you saw a person falling in the road. At first, you will check for danger, assess the surrounding to make sure it is safe to help. Do not enter the situation if it is unsafe. Call an ambulance. Then check the person for a response. You need to call that person. Hello, Mr. X or Mr. Y. Tap the person's shoulder and ask loudly, are you okay? If the person is not responding, you need to shout for help. Get someone to find an automated external defibrillator. After that, assess if there is breathing and pulse within 10 seconds. Provide rescue breath if the person is not breathing but pulse is felt. One breath every 6 seconds or 10 breaths per minute. Check for carotid pulse every 2 minutes. After that, start beginning the CPR, that is the cardiopulmonary resuscitation technique if there is no pulse. 30 compression, 2 breaths. Place both hands in the center of the chest between the nipples. You need to compress. Give compression 100 to 120 compressions per minute. Compression depth is about 5 to 6 cm in adult. Allow full chest recoil after its compression. Minimize interruption of chest compression so that it is not more than 10 seconds. And after the emergency rescue team is arriving, you need to turn on the AED and follow the instruction and immediately take the person to the hospital. Coming for the important question, national immunization schedule for infants, children, and pregnant women. So you all know, whenever a pregnant woman conceive for the first time, then immediately tetanus first dose is given, 0.5 ml IM in the upper arm. Then the second dose of TT it is given 4 weeks after the first dose of TT. The dose is same, 0.5 ml intramuscular. It is given in the upper arm. Then TT booster it is given to those pregnant women they have conceived within the last 3 year. Okay, so 0.5 ml IM. Then for infants, BCG vaccine is the live attenuated vaccine. It is given at birth, 0.1 ml. And if it is not given at the time of birth, immediately at until 1 month of age, 0.05 ml of BCG vaccine is given intradermally in the left upper arm. Then hepatitis B, it is also the birth dose. It is given at birth or as early as possible within 24 hours. The dose is 0.5 ml and the site is IM, anterolateral side of mid thigh. Then OPV 0 dose at birth or as early as possible within the first 15 days. It can be given. The dose is 2 drops. It is given orally. Then OPV first, second, and third, it is given at 6 weeks, 10 weeks, and 14 weeks. And it is given till 5 years of age. The dose is 2 drops oral. Then pentavalent, first dose, second, and third dose, it is given at 6 weeks, 10 weeks, and 14 weeks. The dose is 0.5 ml. It is given intramuscularly. And the site is anterolateral aspect of mid thigh. Then rotavirus, it is given at 6 weeks, 10 weeks, and 14 weeks, and it is given till 1 year of age. 5 drops orally it is given. Then IPV, that is the inactivated polio vaccine, it is given at 6 and 14 weeks, 0.1 ml intradermal site, and it is given in right upper arm. Then coming for the measles first dose, it is given 9 completed months till 12 months of age, 0.5 ml subcutaneous right upper arm. Then ZE first dose, it is given in 9 completed months to 12 months, and the dose is 0.5 ml. Previously it was given subcutaneously, but now it is given intramuscularly. Then vitamin A first dose, it is given at 9 completed months within measles and rubella, and in the 9 months it is given 1 ml, or you can say 1 lakh international unit by the oral method. Then DPT booster first dose, it is given in 16 to 24 months, 0.5 ml intramuscularly, anterolateral side of mid thigh. Then measles second dose, it is given in 16 to 24 months, 0.5 ml given through subcutaneous route in the right upper arm. Then OPV booster, again it is given in 16 to 24 months, 2 drops by the oral method. Then the ZE second dose, it is given in 16 to 24 months, 0.5 ml. The route is intramuscular. Okay, it is given in the left upper arm. Then vitamin A from the second dose to the fifth 9 dose, it is given during the course of 16 to 18 months. Then 1 dose every 6 months, you all know, up to the age of 5 years. And the dose is 2 ml, that is the 2 lakh international unit by the oral method. Then DPT booster second, it is given in the year 5 to 6. Then the dose is 0.5 ml. It is given intramuscularly, given in the upper arm. And TT, again the tetanus toxoid, it is given in the 10 years and 16 years, and the dose is 0.5 ml intramuscularly in the upper arm. Okay, so I have tried my best to include the important questions. These questions may come in your skill test or during your Viva. So this is the part 1 of the video. Already in Assam DME, they are conducting the skill test from today onwards. So hope this video will be helpful for the upcoming exams for all the nursing friends and for the nursing students also. These are some important questions that are very basic and you all should know. So thank you for watching this video, and if you find this video useful, do share among your CHO friend, nursing friends. Thank you.